The first person that I would like to introduce is Deb Jorgensen with Care First of Arizona. She is a Oyfa administrator, meaning she's with the Office of Individual and Family Affairs. So for this presentation today, we'll just use Oyfa. Before becoming to Care First, Deb J. wore many hats as a member of the executive leadership of 2 peer-run and family-run organizations. She believed in social justice. She believes, she's still believing in social justice and strives to affect positive integrated health system changes via stakeholder empowerment, education, and advocacy. And I have known Deb for a very long time. We've worked together and she is a wonderful advocate. We also have Dawn McReynolds, who is with United Healthcare. She is another Oyfa administrator. Dawn leads the Oyfa team and working collaboratively with individuals, family members to gather the voice and experience of our community to enhance, improve, and remove barriers to service for all those served. In 2010, Dawn was chosen to serve as a SAMHSA national representative for behavioral health agencies of Arizona. I believe that's when I first met Dawn, 2010.
That is true.
In San Francisco. My life has never been the same. So
in a good way, right?
Very positive way. Today we're going to be talking about Oyfa, and it's one of the best kept secrets, I think, in the behavioral health system, and that's why we're focusing on Oyfa today. So I'd like to give you a little background on this office, and Deb and Dawn, remember I'm retired and I'm aging, so in this little short presentation, if you want to chip in at any point, please do. In 2007, at the health department, peers and family members came together to talk about establishing an Oyfa office. And we had 2 sessions, 2-day sessions, where leadership and peers came together and developed the Office of Individual and Family Affairs. I was hired about a year later to head this office. So when I first walked in, there really wasn't much hadn't been established. And so we kind of established some of the first objectives, priorities for the Oyfa office, and it was a big challenge. And so one of the first things that I was tasked to do was reduce internal stigma within the health department. The second was to go out into the community and bring barriers and successes to the health department so they would understand. I was to work with peer runs and family runs throughout the state. And one of the biggest things was to educate peers and family members on their rights and to try to establish peer and family members into people that can advocate for themselves rather than relying on the system. So within the first month of taking this office, I was put on the executive team because that's part of what's supposed to happen. Each Oyfa office through contract is supposed to sit on an executive team and be also supervised by someone on an executive team. So within the first month, I'm in an executive team meeting. We're talking about the budget cuts, the non-19 budget cuts. And so they were talking about, how we're going to do this and how disappointed the community is going to be. And I raised my hand and I said, could we put peer and family members on these 3 committees? And Dr. Laura Nelson was head of the department at the time. And she says, oh no, we can't do that. We're just not ready to do that. So I sat there and my little lip came out and I pouted, and my supervisor looked at me and shook his head because he knew I wasn't going to take it. So I maintained my integrity for about 5 minutes, and then I just blurted out and I said, if you don't do it now, you're never going to do it. So they allowed me to put a family member and a peer. Now in our community, we always advocate to put at least 2. We don't want 1 peer or 1 family member sitting in a committee because they're sitting ducks. We need support. So I was allowed to put 1 peer and family member on 1 of 3 committees. So the next day, my supervisor's office is right next to mine. And I saw some people go into his office and I heard some yelling and then they came out crying. They're all females, by the way, heading these committees. So I go over there and ask, and he said, well, Kathy, they're afraid of several things. One, that putting peer and family members that they, on these committees, they won't know enough. They'll be overwhelmed. They'll take gossip to the community and we'll have all sorts of problems. And not only that, but the staff just don't trust them. And I said, well, that's fair enough. So I picked the very best. Carol McDermott was one of them, put him on the committee. And about 2 months later, I have some of the health department employees sneaking over to my office and they want more peer and family members on their committee. So this opened up the door, and instead of creating gossip, what they did is they took the information to the community, shared how hard everyone had worked with these budget cuts, the reason for the budget cuts, and it really created a lot less friction. So that was kind of the start of my tenure at the Oyfa office. And I don't know, about 5-6 years later, we were moved over to Access, and Tom Betlock gave me a call and he said, Kathy, we're taking over the behavioral health component. I am bringing the Oyfa staff over. You don't have to interview. Everyone else had to interview that we're going to get their jobs. But he said, Kathy, you and your team are just automatically off the jobs. So I had heard about Access. I had worked with them. They terrified me. So I thought, oh boy, here we go again. So, and this is a very important point for all the Oyfa offices. I went into a meeting and Tom Betlock, who heads Access at the time, he sat there and we're talking about the policy committee. And he said to the staff, he said, we're now going to have peer and family members on the policy committee. And everyone looked around and they started arguing. And one lady stood up and she said, aha, she said, yes, we're going to have 2 committees, right? One for peer and family members and one for Access staff. And he says, no, he said, we're all going to work together. So when you have the top person supporting the Oyfa office, which you have to have, it was a breeze when I went in there. I was asked to help reduce stigma, to educate the staff. The door was open. I was given a key, a badge that opened up every office in that place. So this just showed the trust. And this was a place where peer and family members had never come and gone. So during my time, to make a long story short, and why I have gray hair, after working there for a number of years, Chaz Longwell and I wrote into contract not only the REBA, but all the plans also would have an Oyfa office. So within that contract is what outlines the details for the Oyfa offices. So we can go in when we as a community are happy with what's going on, we can say it's here in contract. Why isn't this happening? I retired, 2 years ago, and Susan Junk took over the Oyfa office. I have to admit that I saw dark clouds looming and I thought, I'm popular now, I might as well get out before the shit hits the fan, because that's when the RFP went out and there was 6 or 7 plans added to the 6 or 7 Oyfa offices. So instead of 3 Oyfa offices, we had 7. And there, along with that came a lot of problems. Not only that, I want to share that with the REBAs, we all knew each other. We knew the CEOs. We were a close community. When the plans came in, they didn't know the behavioral health community. They didn't know who we are. So these people that got hired, like Deb and Dawn, were very close friends at the time. But it was like sending them into the snake pit. I mean, because their plans didn't know anything about our behavioral health community. They didn't know about the stigma, and they went in there and they're still doing an excellent job. Okay, so I'm going to turn this over to Dawn. And Dawn, if you could share a little bit about the one-pagers that we've developed, and you have a gift for your communication. So I'm going to turn it over to share some of your journey and what you do for the community.
Thanks, Kathy. Yeah, so the Oyfa office has always been known as that front line of communication to our members and our peers. And it's been a vital resource to individuals who are navigating the system, as well as family members. And so what the Oyfa office at Access began to do under Kathy's tenure is create one pagers. And the one pagers are subject based, that are informational step-by-step understanding of different subjects that our population, our members, and our family members are most interested in. Things like how to file a grievance, who to file a grievance with, how many peer runs are currently available throughout the state of Arizona, how many family runs, and other navigational tools. They're on the Access website. If you type in the search bar, Oyfa, their webpage will come up, and it's chock full of all the one pagers that have been created. They're amazing tools. I print them out whenever I go out to community forums. Whenever I send them, my team sends them to family members and members who have concerns. So they're great reference tools in supporting the community. Okay, it looks like she's showing you the Oyfa one-pagers tool.
Plus,
There's,
what I wanted to add is, a member or family member can get these one pagers. And if you're having difficulty getting an appointment, they say, well, you're going to put on a waiting list for 2 weeks. You just hand them this. It says Access right at the top. It says they have this amount of time to get you an appointment. And so it's very definitive and very helpful.
yes. And it is helpful, and that's one of the things that so many of us miss are those helpful tools that can help those that we serve, to help ourselves. I'm an individual with lived experience, and they can actually help us navigate and get where we need to go. Just like the Oyfa office, all the Oyfa offices within the plans are able to help you navigate. Kim Foy is here. She's a member of an Oyfa office within DDD. And so we're all very invested. Our core mission is to be able to support our members and family members, whether they're having struggles, receiving appointments, or, other barriers. Because we know there's a ton of different barriers. We can't list them all, but that's what the Oyfa is here for, is to support everybody through that. And also to really honor your voices as members and family members. And what that means is, just like I have lived experience, most everybody on this call has some sort of lived experience. And we actually ask those questions. We gather information from our members and our family members. We ask for individuals to come on in and join a committee, to join a council, and share your experience. That way we can collect that experience, and that helps us educate our leaders within the plan. Look, this is what our members are facing. This is what our family members are going through, and just trying to get services. How can we help support them and remove these barriers? So as Kathy said, back in 2010, that's when I met Kathy in San Francisco at a SAMHSA conference, and I stalked her a little bit after I heard her talking about the system, the Arizona system. And I thought, this is a lady I need to meet and get to know, because this has been my life purpose. And I need her help in helping mentor me in this area in Arizona. And she did. I was welcomed into the Oyfa family before the move over to Access. I'm just going to share a few pivotal points for those of you who are not aware of some of our history and our peer engagement. One really important key movement that has happened throughout the country was back in the 70s with the peer movement. And it was after individuals were released from institutions. And Kathy actually taught me about this movement when I first came into Oyfa. And what happened was individuals who were institutionalized were de-institutionalized. So our institutions were closing throughout the country. And these individuals have been hospitalized in some cases for a very, very long time. And basically the doors were opened and they said, go ahead and go. And so there were no real resources that were there for them. Maybe they had been medicated for a long time. Their family members were distraught. They didn't know what to do, how to help. And so we had this urgent issue. And what ended up happening was a peer movement was birthed. Individuals came together that had lived experience, and they said, hold on a second, we can work in a community. If we gather each other's voices and fight for the right for our voices to be heard, to have a seat at these tables where people are making decisions about our healthcare, our, what's going to happen to us, what kind of medications we take. If we get it together and come together, we can make a change. And it caught fire throughout the country, and it was called Nothing About Us Without Us. And from that birthed what we call here in Arizona our peer runs, our family runs. And even in the late 90s, we see, individuals with lived experience taking leadership roles. But I want to make a key point here. It wasn't until the Oyfa office was established at the Department of Behavioral Health that Kathy worked with our legislative to change a very important key word in legislation. And I'm hoping you could go off mute, Kathy, and just kind of mention that.
Well, there was two things. One, again, I forget all the particulars, but it referred to people with a mental illness as lunatics and imbeciles. And so, yes, we testified before the legislature and they were horrified. But I'll share that when I get asked to be on jury duty and you have all those questions, and one of the questions, have you ever been in the Arizona State Hospital? And I have to say yes. And then it immediately says you're disqualified because you're an idiot or whatever. So we've got to go back and get that one changed.
Great. And that was work that Kathy had taken on. And it took a couple years to get that. And I'll never forget the day the actual language was put on a plaque and delivered right to Kathy's office at that department. So we celebrate many accomplishments. Today we know, as I said, we have members and family members in internal committees. We have the Oyfa office in every plan. If you go to the next slide. So the Oyfa, as we've already said, some of the main points Kathy reiterated, but really one of the biggest points that I want to point out is leveraging lived experience. For those of you who are on this call that have been through the experience of receiving services or have had a diagnosis of some sort or have loved ones, please hear this. We throughout the state, everyone that's on this call that's in an Oyfa office or in a NAMI group, we need your voice. We need you to be able to step in and share that experience. The only thing that creates change is us all working together, just like back in the day when Nothing About Us Without Us was created. We have not seen a movement like that. And we need to come together and be able to use our voices and create further change. It didn't stop there. We still have work to do. So next slide, please. One of the things that we've worked really hard to do, and we're still working hard to do, is create a career ladder for our credentialed populations. And so we see them going into these entities and helping support, individuals as they move through the jail system or the hospital system. But we've just tipped our toe into those areas. So we need to expand those areas, and working together, we can identify what other organizations we can get individuals participating in. And let's remember, these specialists, these support specialists, are all evidence-based practices that SAMHSA years and years ago said, gosh, we see, I think at that day it was like 72 or 80% of individuals that receive peer support services end up in longer term, more successful recovery journeys. They are able to, help others and affect their lives in positive ways, as well as their family and loved ones' life. So let's go to the next slide, please. I'm trying to go through this quickly. So some of the core values of Oyfa that I have certainly brought from working with Kathy in the department, coming into an ACC plan, the core values have to be taught internally first, so that you get the buy-in of all of those individuals that you're working with. A plan has so many different departments and systems, and so in order to be effective as Oyfa, we have to work with every department within our plans. And so we taught this to the plan, and then we teach it outwardly as well. The biggest point that I want to share is that our approach is all about partnership and relationship building. Nobody cares what you know until they know how much you care. And, that's an old saying, but it's so true. How many times have we been faced with individuals that are trying to tell us about our lives when they don't know anything about us? And so we need to be able to build that relationship and that partnership to positively help affect individuals' lives. Okay, I am done. I'll try to answer some questions if there is. Did anybody want to answer the question that Dina had with regard to NAMI?
Dina, we'll go ahead and answer that question, and then we'll have Deb speak. So she wanted to know how, where is that? How NAMI board members help with Oyfa and use our voices to help. Dina, I think that's something that you and I and Rose and Kenny can sit down and discuss. And of course, Ralph, he's president of NAMI White Mountain. So yes, that's very definite. I think one of the things is just being open and knowing what Oyfa is, so you can refer people. But we'll talk a little bit more about that once Deb has her chance to present. So Deb, you look totally together, like you haven't been frazzled this morning.
Oh, goodness, everybody. Welcome. Hello. And here's my disclaimer. Fantastic job, Dawn.
Thank you,
Our
Deb.
slide said much the same thing, so I don't feel so bad that I can't access mine. But, it's been a morning. They sent me a new phone and wiped my old one before I got the new phone, so I didn't have any access there. And they have a authentication process for work that you have to use your phone for. So I've been just frozen out of my system this morning and spent almost 2 hours with IT on the phone, and I'm still frozen out. So that's why I asked to be last, because I was still on the phone with IT. And Oyfa, working at Oyfa can be fun. They throw you, there's many interesting twists and turns as we're out in the community working with members. I think that, and I think that's one of the most important things. Working through the pandemic, and learning how to navigate the Zoom piece of this has been really interesting as well, and how to connect. It's one of the challenges, I guess, of 2020, 2021, and hopefully not 2022. But there have also been benefits on that side of it. As Dawn said, the Oyfa one-pagers are invaluable. They're developed with the community as a result of questions they have or barriers they faced in moving forward in accessing services themselves or for their loved ones. So I cannot stress enough that the one-pagers, how helpful they can be and how easily they're accessed. Just pull up access and type in, in the search bar, type in Oyfa, and you can find it that way. You have to have navigated this page a few times to kind of do it through just the prompts and everything else, but I just type in Oyfa or Oyfa one-pagers and I end up right there. I can choose it right away. And I found this very helpful. And I wanted to say a little bit more about the question with how NAMI can support Oyfa and how we can work together. For instance, I think later this week, I've got a meeting with Justin, who's on the call, and Ralph, who's on the call. And we'll be talking a little bit more about how, how Oyfa and the health plan can support efforts in suicide prevention and awareness, et cetera, in the White Mountain area and also in Eager. I think we're talking about Eager. So I mean, that's one of the ways. Kathy and I work closely, and Candy, and with the Yavapai NAMI group, and I've attended meetings up there, supported the peer-to-peer call up there, meeting that happens like once a month or so. And and those are just a couple examples. I think one of the things that I'm really excited and proud about is having come to Northern Arizona as a health plan, and Oyfa worked with Kathy and Lori Verdier and NASCARE to establish the Northern Arizona Peer and Family Coalition. And that was really the first of its kind that was tied to the Oyfa office at all in Northern Arizona, and it has been happening since February of 2019 on a monthly basis. It happens on Wednesday at noon to 1:30, and you can reach out and get that information from Kathy and Candy here, who are running this webinar, this Monday thing. Touching on the point about the history and nothing about us without us, we joined forces to begin with during the civil rights movement. And the disability movement in general. So there was just so much momentum, and we were able to, join forces at that time. And then we kind of established ourselves on our own more so. And I think that it's just been my experience that we might have to, we're making some strides, but there are also strides going on the other side, because there's, the self-determination and recovery is possible. I'll always have my diagnosis, and I will always have times when I'm not as when my wellness and my resilience isn't as high. But the beauty of Oyfa and the beauty of the peer movement means that we're stronger together. And I find that, and I find that strength, once you're willing to be vulnerable and work with others and ask for help from others and support others when they ask for help, or maybe just when you notice, that's a big thing in this piece. And I think that we have not succeeded in marketing Oyfa well to this point. We seem to be the best kept secret in the state at some times. And that is, that is why we're so grateful to Mental Health Monday for having us come on and share about the Oyfa offices. One of the things, I have a similar slide that kind of shows all of the community agencies that we work with, and provide, and that includes providers, it includes community service agencies that are supports for our members. Anyone who, it could be a food bank, it could be employment services, it could be forensic stuff. So we touch on pretty much everything within the system, and we bring this knowledge back. Like if we are addressing something in our community at large, not necessarily as Oyfa itself, but in the community at large, say through the coalition. And we're talking, the coalition is talking to legislators, and there's something that really is concerning us or needs to be addressed. We have legislative, but the legislative liaisons, when I'm talking to, Chris Vineyard at my plan, I'm letting him know how the community feels about something, and that can, in that respect, that can change his worldview when he's talking to like the plan president and others in our company, and goes back to, the legislators, or he can learn more about what's going on, that kind of thing. And he can share it. He does the same with me. He shares, okay, this bill might be a concern, and usually the coalition is already on it. There's not much that goes past the coalition, which is kind of nice. And so I really, I appreciate that. And he also keeps me out of trouble, because when I do participate in something that is communication with our, legislators, or advocating for something, making sure that, I make it clear that I'm coming from the community and I'm informing Oyfa, that sort of thing. I worked Access, I worked with Oyfa. I volunteered for about a 9-month period with Oyfa office, and it was during the time that we moved over to Access. And I just want to say that Kathy did a phenomenal job in using our Arizona Dialogue for one. The Arizona Dialogues brings two groups together that are, that get stuck in their own worldviews, which Access is minimal access to information that the public at large really don't need to know. And Oyfa, which is you're serving us. This is our members are being served by you, and the companies that do the best, any kind of organization that does the best, listens to their members and hears what they have to say. And you can pivot much faster in decisions, et cetera, when you know what the impact was on the community. And that's why it's so important for us to be able to talk to people in the community. And one thing I love about the Oyfa office and the representatives and administrators on each plan is that we really have this guardianship of the system itself. And so if someone approaches me, say, and they're from Banner, or they're from, Health Choice, I can immediately connect them to the right person, my counterpart at one of those plans, and follow up and make sure that that person was helped, et cetera, instead of saying, well, that's, here's a number. Oyfa does well on warm handoffs. Internally, just working with the different teams and reducing the stigma by being open and willing to communicate my experience when it's appropriate, and bringing others in to care, to share their experiences with the services, has been invaluable in bringing the view wider to the company itself in how different things and different decisions can impact our membership that receive behavioral health services.
That's wonderful, Deb. You can't escape. Dawn had a couple of things, and then I want to throw out some questions. So stick around.
I'm here.
Yeah, so thank you, Deb, because you made so many great points. And I think one thing that I want to elaborate a little bit on is the collaboration of the Oyfa offices, as you alluded to, Deb. In a health plan, it is a insurance plan. And so there is this kind of competitive edge amongst all the plans. However, with Oyfa, we have stayed true to our mission. And part of our mission is to ensure, regardless of where we are, that our members and our family members are taken care of. And that means that we do not compete with one another. As Deb said, if she has a member that outreaches her from even my plan, her instant reaction is, let me get you over to the Oyfa office at United. It's not that competitive edge of, hey, let me try to steal you.
No. Yeah.
So we have minimized that whole competitive edge. But I think it's also really important to say that each insurance company has a geographical service area that we function in. So there's 7 of us, from Aetna, from United, from Care First, from AZ Complete Healthcare, from Health Choice, but we're not all over the state. And so we have these service areas that we function in. And if you want to see more about that, you can also, Deb, I think it's on the Oyfa page on Access, isn't it? The map. So you can see a map where all of the different plans are designated. So that's all I wanted to chime in with. Thanks.
So this is interesting because I see in the chat that Nancy Sather would like to join NAMI Yavapai, and then Ralph is in there saying he's been communicating with her this morning. So I'm good. So anyway, maybe it's not Ralph, it's Candy. But anyway, we're all after members, and we're all stealing members from each other. But what I would like to share is, Dinah, you raised a very important question. You're new to our behavioral health community. Most of the people on this call work very close together. NAMI works with around the state very, very closely with the Oyfa offices, and we'll start educating you and sharing you that information because you're not on our mailing list. The Oyfa, this is one of the things that NAMI Yavapai has taken on, is to really promote and educate people around the state. We also have the Arizona Peer and Family Coalition that works very closely together with all these groups. So we're all in communication on a weekly basis, sometimes a daily basis. And then we have the Northern Arizona Peer and Family Coalition, which is up here in Northern Arizona, and Lori Vidaire is the head honcho up here. But our idea of what we're doing up here, and I'll let Lori talk, but really to keep an eye on the system. And that's one thing, the impetus to put this program on, because this program comes out of Northern Arizona, because we felt the Oyfa office really isn't known. And, you know, the plans and the, you know, the peers, they don't have any idea about this office. So I'm going to turn it over for a minute to Lori, and she can share a little bit about her work.
So with the Northern Arizona Peer and Family Coalition, we are a direct affiliate of the Arizona Peer and Family Coalition. So if you go to their website, which Candy put in the chat, you can see more about that. And there is a page on NAPFC. We meet monthly, as Deb indicated, on the third Wednesday of each month from 1 o'clock in the afternoon until 2:30. That's okay, Deb, you said noon, but I knew I'd catch up and catch you on it. We, you know, it's different up here in the north with the rural challenges in the rural community that aren't faced in the metropolitan and the great state of Maricopa, as we call it. But there, so we look at what we can do to support family members and peers and the system. And so there's a little bit on Northern Arizona Peer and Family Coalition. If you'd like to be on the mailing list for the Northern Arizona Peer and Family Coalition, info@napfc.org, and Candy will get that in there for you.
So thank you, Lori. I noticed that Emma is on the phone. She's with Family Involvement Center. And so all of us, NAMI, the coalitions, Oyfa, work very closely with the family and peer runs. And up here in Northern Arizona, we have a few more challenges than the rest of the state because the health homes don't like to refer out. So it's hard for our peer and family runs up here to get referrals. And so I don't know if Emma would like to share anything at this point. I'm kind of putting her on the spot, but Emma, if you'd like to.
I want to make sure we have time for questions.
Actually, I do have a question, and this is mostly aimed at Dawn.
Okay.
Family Involvement Center is funded to train parents, and it doesn't necessarily have to be FIC families. It can be anywhere, any parent in the state who is interested in becoming a peer advocate in the way that we've been talking about today. We have a couple of training modules we do every year. As a matter of fact, I believe we just trained, around 45 people a couple of weeks ago, might even been last week, in a mini conference where we present some basic modules. That's a basic training, and then we follow up monthly with support so that people can develop skills in becoming advocates in exactly the way we've been talking about. Family and community advocates on all kinds of levels, you know, with the health plans and with other ways. But Dawn, I noticed that you were talking about a career path for this, and that was something that was new to me, and I'm interested to know more about that because I think that we might be able to build that in to our training and what you think that would take, because at this point we're talking about people who are basically doing this on a volunteer basis. They're getting a stipend. They're not even necessarily doing this through a job like all of us do. All of this comes naturally for us to go to these meetings and talk and, you know, hang out and network. And this is not necessarily something that comes naturally to this population. But you know, to what extent could this be a career path? Because we do have some people we could actually be feeding into some of these. I believe anyway that we could be feeding into some of these organizations. The Oyfa. It's my understanding that Oyfa is a really fun, a really good starting point for people who want to get their feet wet. But anyway, back to my main question. You know, how does one build a career path into this whole sort of type of work?
Yeah, that's a great question. And so as I talked about credentialing, I actually was on that mini conference, Emma. So I remember I presented on that day, and I did talk about the career path that day as well. So individuals who go through a certification training can actually bill for the services and become employed in agencies, whether that be like Family Involvement Center or other behavioral health agencies, and there's codes that they build to the plan that will be able to help them with that career. Now, I would recommend, because I'm assuming you're in northern Arizona, correct?
Sam.
Okay, I would recommend you contacting Deb J, who is over that area and who can support you in those steps in looking at that career path. Deb, are you okay with that?
Absolutely.
Okay.
And I've worked with Jane and know Jane for a really long time. So, so I'm definitely a cheerleader and a support for this sort of thing.
Yeah, so essentially, Emma, just for everybody else on the call, the credentialed individuals who go through training, become certified, peer support specialist or family support specialist are hireable, and they actually begin their career there. Now, we do have specialized family supports and peer supports, things like nutrition, forensic support, and so forth. So the reason I deferred to Deb is she is in Northern Arizona and could work really well with you. We all work with Family Involvement Center, but my population that I serve is the DD population in Northern Arizona. So I felt like this might be a better match for you.
So we also have Kim Foy. I know that recently I have referred a number of peer and family members to both Deb and Don, who up in Northern Arizona, we couldn't get specialized services. They were kind of caught because for the people on the spectrum and people in DD, there wasn't much up here. And, it was really sad to see, because Lori Vidir has been working individually with some of these families and has kept me updated. And you can see how people are slowly slipping through the system, ending up in jail and whatever, because, just basically a person doesn't know how to communicate with someone on the spectrum. And it isn't their fault that they're failing, it's the providers. So, Kim, do you want to share anything about what you do and helping, eliminate some of these gaps?
Wow, I wish I had a magic wand, and I could create services, because I think it's a statewide problem right now, just finding respite, finding home and community-based supports. So what I do is I am a parent, family member, and I think the biggest role that I play is listening to the family, listening, because I'm the children behavioral health advocate. So I listen to the family. Sometimes I hear that it's the first time they've ever had anybody listen to them. And because I do have training as a parent partner, I used my lived experience in understanding what they're telling me. I can relate, and I think that's all part of being in the Oyfa office. I am in the Oyfa office at DDD, but I also have that lived experience of raising a daughter with developmental disabilities, and I also have sons with behavioral health needs. So as a parent, I know what it's like to be blamed for my child's behavior, being blamed that I didn't do what I was supposed to do, when we all know parents do the best they can. So that's what I bring to the table, is that understanding that of being a parent when they are being blamed and they're being told that they're not doing enough and that they're not doing the right thing. And usually it's because they have lack of information. So I provide resources and choices, and never telling them which way to go at all, just giving them information so they can make an informed decision for themselves.
Hey, and this is Dawn. I know we're running out of time, but Kim, that's a really great point, because like Lori has actually outreached me with member issues, and they're not in my plan, but I've been able to refer them to, you folks or other plans. So that's a great point. Everybody can reach out to Oyfa, right, Kim?
Right, and the DDD Oyfa is statewide, so.
So I think that's the next question that I had. So Dawn and Deb, when a family or peer reach out to you, they can't get services, they're very frustrated. What do you guys do?
Well, I think one of the most important things is the first thing we do is listen, actually listen and validate the frustration that's happening. As you know, as a parent and as a peer myself, these are frustrations with lived experience that probably, you know, I've had similar barriers. And just, you know, respecting the journey that the person is on. And then I don't have all the answers, but I know people who have the answers in the different areas, and I'm able to connect them and with a warm handoff to who they need to talk to start working on what the issue is specifically. So I think that's, and also, you know, our community supports are really important, because sometimes it's not something that a health plan can do. If it's outside of services, you know, it can be any number of things, because our wellness is comprised of more than a doctor visit, medication, and our, you know, and a therapy. It also, we need safety to recover, and that translates into housing needs. What if someone's homeless suddenly, or they're about to lose their home? We've got a housing specialist at our plan, and as do the other plans. It could be no food. And Dawn, pick up where I left off, because
Okay.
I know there was a question in there.
You're so funny, Deb. You did great. You did great. Okay, so very quickly, time is of the essence, as Deb mentioned. So how we go about, first we look up the member, or, you know, the information to verify. Then what we do is look at that contracted provider and find out, you know, like if it comes to me, am I contracted with that provider? If I am, I then began to navigate internally and pull in other departments to actually notify our other departments that this provider may not be offering the correct services or creating barriers to care. Remember, that's one of our lanes as Oyfa, that we want to remove barriers to care or access to care. So then we have footing to be able to do that. And then we begin to work with that provider, and I'm pretty, you know, straightforward with the fact that this member needs care, and what are they doing to meet this member's needs. And so when a provider hears from a plan, I like to also include some of our other leaders within the plan. But the mission is to educate the provider that Oyfa is on the scene, that we are aware, and that we're watching to try to resolve these issues. Now, we are constrained. Remember, I talked about the geographical service areas. We're also constrained by if this member belongs to United or if they belong to Care First. And that's where that collaboration piece comes in. We send the information to the other Oyfa office, and we try to ensure, and we will stay on as long as we can to ensure that there's no repercussions as best as possible, you know, on this member, their family, and that these issues are resolved.
So Deb and Dawn, okay, cool. Lori and I and Candy are always on bug and access about, you know, barriers in care, offering choice to members, you know, why in some parts of the state do members not have choice, where the rest of them parts of the state they do have choice. And they say, well, they can file grievances or complaints. But, you know, especially up here and in the rural areas, people don't want to file complaints or grievances because they're afraid. And so then Access says, well, you know, our data shows that there's no complaints, no grievances, so we can't do anything. So I feel very frustrated. And, you know, it's up to individuals that have the courage to make those complaints. So could you kind of address that?
I'll take this first, Deb, and then if you want to chime in, since we work so well, and Kim too, because this is, you know, an Oyfa systematic. So one of the ways that we get around that is if we get, like, if I get a call and there's a member and the member or the family member is afraid of, you know, punitive responses towards that member, I will then begin to just outreach the provider and begin to ask questions without talking about the individual or the family that's, you know, and then what you do, because access to care and removing barriers to care is our lane, I can then begin to ask, knowing that that issue is out there with that particular member, I could formulate my questions to that provider and ask for information regarding, you know, these specific services, what's happening. And we always get information that says we're doing great. Everybody, you know, is doing great. So then what do? We go in and begin to really work with that provider. I start holding trainings, and it's almost like a pit bull kind of effect. You can't let go just because you get a document that says, you know, everything is good. And so it's an investigative process that we have to continue to go deeper and deeper into and make suggestions of updates or, you know, corrections that need to be made. Now, what does that mean for me and my plan? That means I have to pull in the provider liaisons. I have to let my supervisor know. I might get in trouble again because I'm going deep, you know, but it, you know, so there is a process where we could get around that if it's our member. Remember that contractual, you know, obligation of servicing our members is really hard on us as Oyfa because we want to help everybody, you know. I'll toss it over to Deb and Kim.
Well, I think that, thank you, Dawn. I think that it goes back again to working, you know, working together and being mindful that we're looking at the system in general and, you know, making sure that if that's a barrier. I had the experience of, I was at a peer run before I stepped into this role at the office, and transportation is always everyone's favorite topic. And we were having a lot of difficulty with transportation, actually, you know, canceling rides, not picking up people, everything else. So as an experiment, I had the staff collect information every time that transportation had to be called again, or it was canceled, or, you know, came early, or whatever it was doing. And so, and I would say for every 60 reports I had, I maybe could get one person to actually make a complaint. People are very, very intimidated, those that receive services, because they're afraid that it's going to affect the relationship with the provider. And unfortunately, oftentimes it does. So, you know, with all of us working together and we find, you know, okay, somebody said something about this, I know that probably, unless it's a very, very unique thing, probably this isn't the only time this has happened. And so, as Dawn said, not only could she formulate within her health plan, and if that person isn't a member, say I go over to Dawn, but Dawn and I will still be talking, and we bring it to the leads meeting monthly about this issue was raised, and then all of us will start asking about that, because we share providers, we share areas, and and so we try to work with, together, work smarter and not harder in making sure that, is this an issue or is this not an issue? So I think, I think that's really helpful. But, for instance, in Yavapai, I've had more phone calls because NAMI gives them my number than, than I get in almost anywhere else in the Northern Arizona area. Also because I will get calls from FIC and Trish over at FIC. So there, there's that kind of work. It's when Don says, keeping it supportive, and I would always, the referral process is brutal. And I would always tell my staff, it's just, you're at the door, you wag your tail like a Cocker Spaniel, and you stick your foot in the door like an encyclopedia salesman, and don't take no for an answer until, you just win people over. And you can't do it with muscle and intimidation. You can do it with building relationships. As all of us know on this call, the relationships within our groups support us in building resilience, in resource utilization, in knowledge, and the rest. And so, honestly, if a system isn't optimal, relationships can get around, can make an inroad. But at the end of the day, we all need to be working together and say this is unacceptable, just like the legislation that stops calling us morons.
So Kim, do you have anything to add?
I think one of the biggest things that we can do with our lived experience is being present and letting people know that we care. We also have a passion for resolution, staying with the family until they tell us they don't need us anymore. I kind of practice in a way that I don't make that decision. I let the family make the decision when they feel like they can take it from here. But yeah, we do collaborate. I know I collaborate a lot with the health plans. There's a lot of things I don't have control of. And to pull the health plans in towards resolution is a wonderful thing.
So Candy has something to add.
I wanted to tell you that there are two, and I put these links in the chat earlier. The Oyfa, the Access Oyfa page does have a feedback form that you can fill out. In addition to that, the mentalhealthresource.org site has a "We want to hear from you." Both of these forms you can provide feedback on. The Access one, they do ask for some information. I don't know whether it's required. The one on the mental health resource site, all you have to do is give us an email address so that you can get through our spam check. And you do not have to put any other information. We gather for the mental health resource site, which is the NAMI Yavapai site, we gather this and focus on then our advocacy based on the feedback that we receive there.
So thank you. And then Lori Badir.
Yeah, I just want to share that I help people navigate through the system that come through the resource site that Candy just showed you. And I work with them and refer them, connect them to the Oyfa administrators and managers throughout the state. And, obviously things are done differently in different parts of the state. But if we find a gap in the system, Oyfa needs to know. And if people are not wanting to make an official complaint because they're legitimate in their fear of retribution, because it does happen. Unfortunately, it has happened, and people don't forget and they talk to each other. So it isn't just a paranoia, it's a well-founded evidence-based fear that we're trying to get rid of. But in the meantime, I find that there's a real evident gap in the system now for people that have adults with a serious mental illness who are on the spectrum. And it can be very complicated, but the fact is, I am working with KIBAB with a particular case that I'm helping and have been for a period of time. KIBAB is fantastic. There is specific training that people in the behavioral health clinics don't have to communicate with people on the spectrum. So, for example, they say, well, do you want a behavioral health worker? Do you want a peer support? And the default for a person may be just to say no. And the behavioral health person may not know, I've got to explore this, explain it. There's a way to communicate with folks that they don't have the training to do, and that pushes people through in the cracks. And so this is something that being vocal, let Oyfa know when you find whatever there may be a barrier or a gap. And if they're not wanting to file a complaint, if we talk about it enough, if we do the forums and provide the education, we're getting somewhere. And I have a direct line with Susan and the Oyfa leads, and I use that. And the collaboration and the cooperation is fantastic with Oyfa, but they can only do so much. Something I would like to suggest, and we're looking into it, is let's get flyers into the clinics where they have the racks in the front and promote Oyfa. Let's educate, because the people receiving services don't know about Oyfa. Let's get the word out there and be creative in how we do it.
I have one quick question before we wrap up, and hopefully it's quick. I just want to make sure, Deb J and Dawn and Kim, that you will assist people whether they are on access or not, or are your services only available for people on access?
I actually cross all lines of our business at United Healthcare. So we work with individuals from like our commercial line as well as our Medicare line. We have, the DD contract. We're one of two, which Mercy Care is the other contracted plan, and long-term care. So often if I have an individual who's not on access and wants to be, we'll refer them over, and help them if they need help and support in filling out that application. And if it's an individual that has other insurance, if they're a United member or a family member, we'll assist them. Most often we have to build a bridge to a different department, which I think Deb was talking about, the relationship factor. That's where that comes in to play. But we definitely assist all our members and family members.
There are other avenues for people to get help if they're not a member of a health plan at all, if they're not, and a lot of times it's just pointing people where to start. Honestly, there'll be someone who calls and their loved one they haven't had an evaluation, they haven't had anything happen yet. So connecting to those, accessing those sort of things are there as well. And then usually, we'll have some knowledge of a reason, sometimes, not always, but a reasonably priced place to start, a clinic in different areas. I'm learning more about Northern Arizona. I've been in Maricopa for a long time. But we reach out and we ask those questions, like who can help this person, to our community contacts. There's, Ralph is fantastic. Candy and Lori and Kathy and Rose are invaluable in their areas. And so the other piece is that Oyfa doesn't have all the answers for sure. And we need input as well. I welcome someone calling me and say, this would be a good idea, or is there any way something could happen like this, or, or something creative born out of frustration. That feedback helps our office as much as it helps the system. And one thing I would like to ask everyone is, how can we as Oyfa, what would be effective in getting the word out about Oyfa in your community? How can you help us with that and suggest ways we could do that? Because it seems like a no-brainer, and here we are, 3 years later and still a secret. So I want to, you know, I don't think we can fix it alone, but I know we have a lot of sharp people just on this call alone.
I just wanted to jump in and talk about, you know, those that don't have access. I recently talked with Laurie of Vidir, who sent me an email, and the member actually wasn't even aware that they had access. So there are times when individuals do not know that they are covered by access. So as Oyfa leads, we can look them up and see what their insurance is. So I just wanted to kind of chime in on that endpoint too.
So one quick question. Okay, go ahead, Ralph.
Yeah, just wanted to point out that Nancy Sather's on this call. She's muted right now, but she's been communicating in the chat, and I hope, Nancy, I'm not speaking out of turn, but Nancy was a member of our NAMI chapter here in the White Mountains, and she actually couldn't get the services for her daughter that she needed, and she moved down to Yavapai County to get the services. And that's an example of, you know, the problems we have. And she did provide some information in the chat about the particular circumstances that she ran into at that point in time several years ago. You know, good news is things from our communication one-on-one, seems like things are going better for her daughter, and that's great news for all of us who are family members and our loved ones. So I think, you know, when we're talking in general, and that's what this call is about, we're not problem solving. I understand that from the many times I've participated in these calls, but it just points out again, Nancy's an example of pointing out that, you know, we don't have parallel services. We don't have two choices in many cases for things that we're looking for and things that we need. That's a problem of rural America, not just rural Arizona, I'm sure. But, you know, part of what you folks who have more power than I do are doing, it's very vital to the future of our society to get some of these problems resolved. And God bless Candy and the folks who put this website together. We refer people to that, you know, like, you know, that's one way to get get your voice heard when you don't. Yes, that people are reluctant to speak up and even admit that there's a problem, and they don't want to put it in writing. But, you know, at least there's a way to create. Sometimes problems are solved because somebody complains about them, and other times they're solved because a number of people are complaining without any particular names associated with it. It's called statistics.
Well, thank you, Ralph. And, you know, I think one resolution is single case agreements, because even though we don't have a lot of these services up here, the plans can refer out to Maricopa and where there are services. And we need to educate people that that's a possibility. I hear Candy squirming behind me, so she's gonna take this away from me now.
Well, and I don't need to be on camera specifically, but I did want to thank our speakers who came today and the wonderful discussion. I'll tell you, I was meeting with my son's case management team, and none of them knew about Oyfa, had ever heard about Oyfa. And that's OIFA, and that's Office of Individual and Family Affairs. And as you learned today, not only does the state have an Oyfa office, so do the individual plans. And once again, on that resource site, there is a link to all of the Oyfa offices and the individual plans on the mental health resource site. So once again, I want to thank everybody for coming and our speakers, and we'll see you next month. Oh, I'm just going to also mention, we're taking December off. There will be no Mental Health Monday in December. It's the Monday after Christmas. So we decided we'll all take that as a holiday. Thank you again for coming.
Bye-bye, everyone.